My name is Caitlin Notley and I lead the Addiction Research Group at the Norwich Medical School at the University of East Anglia, chairing the Scientific Committee for the Global Forum on Nicotine conference for the last 3 years. I'm really delighted to welcome you to this key scientific session as part of our online GFN 2020 conference. This is of course an important and timely session focused on COVID-19 and other epidemics, reviewing the evidence, considering the challenges for tobacco harm reduction. We have excellent world-class speakers for you in this session, covering all aspects of nicotine use in the time of the COVID-19 pandemic. I really want to thank the GFN organisers who have done such an amazing job of moving the conference online and ensuring that we can continue the tobacco harm reduction conversation even in these most challenging times. So before I introduce our expert speakers, I want to take a few moments just to reflect, if I may, on the balance of gender and ethnicity in our programme. You'll note that GFN is extremely proud to be truly global in its representation and reach, tackling tobacco harm reduction and carefully ensuring representation of low and middle income countries as critical to addressing questions of global importance. It is just as important to me as chair of the scientific committee to ensure equal and fair representation of both male and female academic colleagues. To this end, I must point out that the GFN team have worked extremely hard to invite eminent speakers, ensuring good representation, but also were mindful of people's commitments and challenges during this extremely difficult time of the pandemic. We regret that Dr. Deborah Robson of King's College London was unable to present her really important work on nicotine use and mental health. Scientific endeavour in the field of tobacco harm reduction based on the fundamental elements of the scientific method, including respect for the integrity of knowledge, collegiality, honesty, objectivity and openness is paramount. As we know, the use of nicotine in its various forms incites strong feelings and what can be a divisive approach to the presentation of evidence. This has never been more evident than now in the time of coronavirus, when we've seen sensationalist media reporting stigmatising smokers and vapers too, as possibly putting themselves and others at increased risk of infection. We've also seen sweeping social changes limiting the availability of reduced harm products for some. The closure of vape shops in some countries, for example, may have significantly impacted on health outcomes by limiting accessibility of e-cigarettes and consumables. Some countries have been able to keep vape shops open during lockdown as essential services, and in other locations we've seen some innovative responses such as enabling remote deliveries and offering peer-to-peer advice over the telephone. It has been my aim to transcend agenda-driven divides in the field of those pro- and anti-tobacco harm reduction, to focus on the evidence and the quality of the science that underpins that evidence, rather than a narrow focus on the funding source or the misreporting of evidence to meet certain political aims. Whilst I encourage all speakers to transparently declare funding and potential conflicts of interest so that the audience may judge the science on its merits, I ask you as the audience to assess for yourselves the quality of the science presented in terms of the methods, the conclusions and the consideration of alternative hypotheses and explanations. Please do question the speakers in a respectful way and stay focused on the objective evidence and its implications. Our first speaker, Professor Ricardo Pilosa from Catania University in Italy, will address you on the topic of smoking, vaping and COVID-19. What does the science tell us? Ricardo is known in the field as a leading respiratory physician. He will discuss what we know about viral infections and the respiratory system, focusing particularly on the unique aspects of the coronavirus 19 pandemic. He will then discuss the contested and confusing literature we have to date internationally on smoking status and coronavirus infection rates, highlighting quite rightly methodological limitations inherent in the data, such as poor reporting of smoking status, misreporting, bias and potentially confounding variables that caution us in our interpretation of the evidence. Dr. Konstantinos Farias from the University of Patras in Greece will talk on the topic of unforeseen circumstances, nicotine, COVID-19 and the ACE2 receptor. He uses available cohort study data to underpin a hypothesis that nicotine use may be protective in down-regulating the ACE2 receptor, meaning that individuals may be less susceptible to contracting coronavirus. However, the studies he reviews by no means unanimously corroborate this finding. The consistent finding across a number of countries, however, led to the generation of a new hypothesis about the role of nicotine in controlling the hyperinflammatory response that characterises those who have the very worst outcomes from coronavirus. And Konstantinos clearly describes these for us. This is fascinating, groundbreaking, hypothesis-generating work that I encourage you to closely examine. Dr. Pinny Matzner is a senior data analyst and data team leader at Signals Analytics based in Israel. He discusses in his talk using analytics and big data to identify disease outbreaks. This is a highly relevant and current preoccupation in terms of how we internationally might make best use of existing data. Pinny focuses first on cases of lung injury, otherwise known as EVALI in the US, discussing the potential of monitoring social media data prior to pandemic outbreaks as early warning systems. And finally in this session we have Dr. Roberto Sussman from the National University of Mexico. Roberto completes our focus on the science of nicotine in the time of coronavirus by considering the consequences of bad science and its communication for consumers, particularly focusing on media reporting and policy reactions. Roberto takes a unique approach focusing on environmental exposures, considering the evidence of any possibility of increased risk of contracting coronavirus for vapers in particular. Of course, the available evidence in this respect is extremely limited. Roberto clearly synthesises what is known on this topic and directs us to a cautious interpretation of media reporting linking vaping and COVID-19 infections as reporting that is likely based on exceptionally tenuous data. So, please do relax and enjoy these presentations. Submit your questions for our live question and answer session. I encourage you to critically review the quality of the evidence, the way the data is collected, the study designs used, and the limitations of the available study designs. There has been great interest in the potential protective effect of nicotine use for coronavirus infection rate, disease severity, prognosis, and outcomes. Similarly, there has been increased reporting on the risks of smoking and indeed vaping for coronavirus outcomes. Clearly, there is a need for further study in these important areas, but for now I encourage you to engage our speakers in scientific debate with the aim of advancing understanding and pushing the field forwards following this GFN conference.